Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institute. Today, we have another role play to execute as always. So what we're going to discuss today is this role play. So this is a very simple role play in which a patient is 23-year-old. He is a PhD student. He was admitted 2 days ago and was diagnosed with acute pyelonephritis, that is kidney inflammation due to the bacterial infection. So the patient is suffering from bacterial infection and he was admitted 2 days ago. He still has a fever and has not been able to eat or drink yet because of persistent nausea. Because of the nausea, he is unable to eat and drink. He has been given intravenous therapy until now. So IV therapy is going on. He is upset and is insisting on discharging himself from the hospital. So he wants to go back home. However, the doctor feels he is not fit to go at home at present. So doctor feels you are not fit to go. So please do not go. That is what is the recommendation. It is the suggestion of the doctor that he should not go. Then let's see what are the other points. Find out why the patient wants to be discharged. So we have to first find out why the patient wants to be discharged. Response to the patient's statement about continuing. So respond to the patient's statement about continuing treatment at home by explaining the nature of his or her illness. So when the patient will say, first of all, you will ask, why do you want to get discharged? Second thing, tell him that continuing treatment at home is very difficult because your illness is pyelonephritis, which is kidney inflammation, and you are unable to eat or drink anything. So we can't discharge you. And also you are having fever even now, and you are having nausea. So it is not the right time. So your body is rejecting or will reject oral medications as well. So यहाँ पे एक point there, your body will reject oral medication as well. So उसको ये बताना है कि अभी it is not safe to go home. Then patient will say, oh no nurse, I want to go home. Then tell him the importance of staying by outlining the risk. So tell him that there are risks involved uh, of getting discharged without the doctor consent. Kidney damage or failure may happen, risk of blood poisoning. So there are various things which may happen. So please understand at this moment it is not safe for you to go home. Offer to resolve the issues by shifting him to a different ward. Those offer again in the exam you will get 3 minutes to prepare. Today also I have sent you few bit of tips, few bit of speaking things in योर व्हाट्सएप. मैं आपको दोबारा भेज देता हूँ. वैसे मैंने आपको आज व्हाट्सएप पे बहुत इंपॉर्टेंट स्पीकिंग के टिप्स भेजे. मैं आपको दोबारा भेज देता हूँ जो हमारे डॉक्टर बीकेएम से कोचिंग ले रहे हैं. सो ऑब्वियसली यू विल गेट सम टिप्स. So I have sent you common lines which are used in the speaking. So these are the common lines like, do you smoke? How many cigarettes do you smoke? Do you drink? How much do you drink? 3 minutes to prepare. So मैं आपको one by one वो पढ़ भी देता हूँ. What are these things and what I primarily want to say by these things? Let me tell you. So I will read these statements one by one. You will get 3 minutes preparation time. That means the task that I have just prepared, you will get 3 minutes. 5 minutes of each role play. You will get 2 role plays and you will have 5 minutes to speak. So overall speaking would be of 20 minutes. First warm-up questions will be there. It does not have any marks. You can skip any point. There is no deduction of marks. आप कोई भी पॉइंट छोड़ सकते हो. जैसे अगर मैं ये पॉइंट नहीं बोलना चाहता, ऑफर टू रिजॉल्व इश्यू बाय शिफ्टिंग हिम टू डिफरेंट वर्ड, बट इस रोल प्ले में हम नहीं छोड़ सकते क्योंकि पॉइंट्स भी कम दिए हैं, हमें 5 मिनट्स भी कवर करने हैं और टास्क भी इजी है. तो इस टास्क में हमें नहीं छोड़ना चाहिए. लेकिन बाय चांस अगर आप किसी एक पॉइंट जो आपको समझ नहीं आता आप उसे छोड़ देते हो, देयर इज नो डिडक्शन ऑफ मार्क्स. ओवरऑल यानी कि लास्ट में रिपीट करना जरूरी है. ओवरऑल आई वुड लाइक टू रीएश्योर यू दैट देयर इज नथिंग टू वरी. तो रीएश्योर वर्ड बहुत इंपॉर्टेंट रोल प्ले करता है, या लास्ट में टास्क को दोबारा से समराइज करना बहुत इंपॉर्टेंट रोल प्ले करता है. सो पॉइंट्स के कोई मार्क्स नहीं है. प्लीज रिकॉर्डिंग को दोबारा सुनना. और मैंने आपको ग्रुप में भेजी थी, आप सबके पास हैगा ये, आप अपने ग्रुप में देख सकते हो जो भी डॉक्टर बीकेएम इंस्टीट्यूट से पढ़ रहे हैं. एग्जामिनर डज नॉट हैव एनी मार्क्स, ही इज जस्ट अ पेशेंट. प्लीज, examiner does not have any marks, he is just a patient. 3 minutes prepare karo and you always behave like a nurse. Do not panic, he does not have any marks. दोबारा से, examiner does not have any marks. ये सब मैंने आपको रिटर्न में भेज दिया है. So 3 minutes का रोल प्ले होता है और मैंने आपको हमेशा सिखाया है फर्स्ट लाइन को आपको हमेशा लिखना है. So इस केस में गुड मॉर्निंग, आई एम योर चार्ज नर्स फॉर द डे. अगर पेशेंट आपके हॉस्पिटल में पहले ही है, एंड आई कैन सी फ्रॉम योर केस नोट्स. सी फ्रॉम आई कैन सी, हमेशा ये लाइन बोलनी है जब आपको दिख रहा है एंड आई कैन सी फ्रॉम योर केस नोट्स दैट, बाकी लाइन दैट यू आर दैट you were admitted because of, बस यहाँ से connect हो जाएगा, that you were admitted because of, spelling mistakes please वैसे भी speaking में matter नहीं करते, admitted because of kidney inflammation या kidney infection, am I right? ठीक है, सो दिस इज हाउ यू से। बाकी पॉइंट्स इजी हैं, वैसे आप पेपर में और पॉइंट्स भी लिख सकते हो, जैसे अगर मेरे को ये लिखना है वाई, अगर मैं इसको पॉइंट को एलोबरेट करना चाहता हूँ तो मैं ये भी लिखना चाहता हूँ, सॉरी मेरे को वापस पेस्ट करना है उसको, सॉरी वो चला गया, चलो मैं आपको बोल के दिखा देता हूँ। गुड मॉर्निंग, माय नेम इज भूपेश, आई एम योर चार्ज नर्स फॉर द डे, सो आई कैन सी फ्रॉम योर केस नोट्स दैट यू हैव बीन एडमिटेड टू आवर हॉस्पिटल 2 days ago with kidney inflammation due to bacterial infection. Am I right? Yes, nurse, you are right. Okay. So we can also see that you are still having fever and you have not been able to eat or drink because of persistent nausea. Am I right that you are still having nausea? Well, yes, nurse, that's right. Okay. So I would like to ask you, how are you feeling now apart from the nausea? Are there any other problems that you are facing which I can help you with? Well, nurse, yes. Okay. Please let me know how can I help you and what is bothering you. Well, nurse, I want to go home. Well, could I please ask you, why do you want to go home? Because doctor has just seen you and I can see from the case notes that you are not fit to go home at present. Doctor has mentioned it very clearly that you should stay in the hospital and you require our expertise, you require our attention. So at this moment, you should not think about going home. But nurse, I am really upset. Could you please tell me, why are you upset? Well, nurse, this ward is having so much of noise, like everybody is making noise and they are not letting me have rest and I'm feeling very bad. Well, I'm really sorry to hear that and we definitely will help you in this regard. So you are saying you are having many problems, that people are making noise over here. So if you do not mind, I can offer you by shifting you to a different ward. So what I can offer you help where you can be shifted to a different ward. So you can shuffle the role play. I have spoken the last point first, so you can also do that. Oh nurse, no, I don't want to shift any ward. I want to go back home. Well, I'm sorry to say, but I would like to repeat that doctor has told that you should not go home and your condition requires lot of attention. And also I would like to tell you that the nature of your illness is really bad at the moment. It is risky because your body is not accepting fluids and you are not eating anything because of consistent nausea. So even if you go home, you will not be able to take the oral medications. So right now over here, you have been on intravenous medications. So medications are very important and you should not think about going home. Medications will play a very important role in your recovery. But if you are not able to eat anything, how would you take your medications at home? So this is not the right time to go home, I'm afraid to say. But nurse, you are not understanding. Rest is very important. I think I'm not taking rest. That's why I'm having these problems. If I would take rest, I would be fine. Well, I understand what you mean. And again, I apologize for the inconvenience that you are facing at the moment. For that, I have already told you that we will shift your ward and you will start feeling better. So there is nothing to worry. And also, I would like to emphasize on the importance of staying in the hospital and would also like to tell you the risk of getting discharged is really high without the doctor's consent. Because you are having a kidney problem, it can lead to permanent kidney damage or can lead to kidney failure as well. There is a risk of blood poisoning. As you know, kidney is connected directly with our excretion system and it helps in excretion of toxic material from the body. If your kidney is having inflammation at the moment due to bacterial infection, so it will not perform nicely. So if by chance something wrong happens, it can lead to some serious consequences. So please understand, at this moment, shifting to your home is really risky. Whereas if you will shift to different ward, you would have no problem. And also, I know that you are a PhD student, so you must be needing some isolation for your studies. So we assure you for the best services and providing you a different ward. How does that sound? Well, that sounds all good, nurse. If you're saying it's risky to go home, I can stay. Well, that is great. Thank you for accepting this proposal because it's really important for your health and it is for the benefit of your health only that we gave you this proposal. And I'm just going to talk with the doctor so that we can shift your ward. Is that fine? It will take just around 15 to 20 minutes. Is it okay? Well, yes, nurse, that's okay. That's great. And now I would like to again reassure you that you will feel better in hospital and we will provide you the best services and your ward will be shifted immediately. Is that okay? Well, that's okay, Nas. Okay, then take care. I'm going to help you with the process as I have to fill the form for shifting your ward. But if you still face any problem, you can press the buzzer. I would be right here for you. Is it okay? Well, that's okay, Nas. All right, then. Thank you. And this is how you complete your role play. Again, 3 minutes to prepare, 5 minutes to speak. Speak the best role play. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967 34256. Thank you. And if you have any query, please leave in the comment box. We assure you for the best OET coaching. Thank you.